All right, welcome to our webinar on bulletproofing your low back. And we're going to actually define exactly what I mean by bulletproofing the low back because it doesn't mean that you never have back pain or never injure your back. When you have a bulletproof vest on, doesn't mean bullets don't come. It means that you're protected. And so life is going to happen. What I want to see is that you recover in a readily and appropriate way, that you can stress yourself and then you can recover quickly. And so we're going to be looking at all of those pieces and all the reasons why people join a webinar like this. I find that there seem to be two groups. The first group is folks that are, maybe they just have had a few episodes of back pain and they just don't want it to go in the wrong direction. So they want to be proactive about it and just get their spine as strong as possible so they can prevent any future trouble with their low back. And then there are the folks that have just been struggling with chronic low back pain and are just looking for some answers. So I thought it was interesting that today in my chiropractic journal, the lead article was "The Wrong Way to Treat Chronic Spine Pain." And it is an article from the British Medical Journal that basically is saying, don't do injections, don't do radio ablation, like don't do those things. They said, unless it's part of a clinical study. That's what they said. So they said anybody that is looking for actual improvements with their back, don't do that. And so that includes steroid injections and anesthetic injections and epidural injections. All of those things are listed in the article. So the timing is right for us to talk about this, like what can we do then? And so let me do my screen share here so you can see my PowerPoint, and then we will be off and running here. All right, so can everybody see my PowerPoint slides? Give me a thumbs up on that.
I can, yeah.
Okay, great. All right. So I want to stay right on track, but I also want to invite participation. So if something comes up that you have a question about something like that, feel free to ask, and if I feel like it's taking us off track too much, I'll hold off at the end, and I will cover that question at the end. And I also just wanted to let you know that, of course, this is part of our every month series. And so next month, we will be covering how to get 15 pounds healthier in 15 weeks. So the timing is right for May for that, for many people that are watching that. So today, I want you to be watching and thinking about your spine and your low back. And that's what we're going to jump into right now. And so what is it that I see when people come in and present to me? What I see is that they, of course, are experiencing low back pain, but they may also describe, well, I got these tight muscles and I lost my range of motion. I'm kind of stiff, and some people are actually getting pain going into their buttocks or their thigh or right down their leg, even into their foot. Some people are feeling like there's swelling in their low back. Some people might get a burning kind of pain or numbness. And along with the numbness, many people might describe some weakness. They might feel that burning and numbness going right down into their feet, like a neuropathy. So those are all of things that are kind of in a cluster of what people talk about when they are experiencing low back pain, whether it is an acute incidence or whether it's a chronic occurrence. And as far as the stats go on that, right now, 1 out of 3 people are struggling with back pain in this very moment. So if you think of all the people you know, 1 out of 3 of them are struggling either with some sort of acute injury or with some sort of chronic thing that they've just learned to tolerate or to live around, or just to try and endure. And the research shows that it really matters. The very first incident of back pain that you have, it actually really matters what you do about it and which direction you go with it and what your ultimate outcomes will be even years later. So the research shows that if you go to a medical doctor for your first incidence of low back pain, 20% of those people are going to end up being operated on. If you go to a chiropractor as your first incidence of low back pain, only 5% of those folks end up being operated on. And in my own practice, I believe, if I can recall, I've had 4 people in 40 years that ended up having to go and have surgery on their low back. And if I think really clearly about them, I'm pretty sure three of them had not seen me as their first visit, and I was kind of their last resort that they were looking for help with. So if I do the numbers in my practice, it comes out to way less than 5% of my practice where people that are coming to see me, if it's their first incidence of back pain, way less than 5% is actually going to end up with surgery. So it really does matter over how you start things out and where you go from there, because it sets you in a funnel, and it sets you on a course. So I'd like to help people course correct. That's what my job is every day. I'm looking for where are the people that I can pivot them away from the course that they're on so that they can actually get on track with what they actually want, which is to be as healthy as possible, of course. And when it comes to low back pain, many people, their minimal goal is, I just want to be able to tolerate this a little bit more. I think people are aiming way too low. Like the bar is way too low on what people are tolerating when it comes to back pain. And when I think of people in my practice, I'm thinking of the contractor who is an occupational athlete. You know what I mean by that? Like a professional athlete, they just need to have a good, strong body for 5 years, right? And then they retire, maybe crippled, but then they retire. Whereas an occupational athlete, they need to have a body that's there for them their entire career. And so for people that are using their body in their work, occupational athlete. And so one of those folks that came to see me, his name was Jeff, and he had an injury to his low back. And we were able to actually get him right back to work because it was not just something that was uncomfortable. It meant he couldn't work. So that affects your lifestyle and your family's lifestyle as well. Another example is a woman who, she was a teacher, Donna, but she was also a mom. So she had little kids she had to pick up, and so she was struggling, and we were able to help her out, got her spine strong, so she was able to now participate with her kids, be the mom she wanted to be, show up at work, be the teacher she wanted to be, and continuing on to not have relapses occurring. So as her kids grew, she stayed strong with them. And then, of course, there are the athletes that I have in my practice, not just the occupational athletes, but the serious athletes. Like I'm thinking of the bicyclists, like crazy guys that are so demanding on their spines and their backs and their bodies. And, low back pain can take you right out of your sport and out of what you enjoy about your sport. So we've helped folks like that. And then, of course, there's the executive, the disc jockeys, or desk jockeys is what I meant to say, right? The desk jockeys that are in front of those monitors, the executives who are the weekend warriors. And definitely have had those come across my path, working 60-hour weeks and then trying to make up for all that sitting over the weekend and getting into trouble with it. So that's the kind of people that I tend to see. And so here's what we know. It's incredibly widespread. It affects every age, both male and female. And in fact, in my 40 years, I'm now seeing it show up in kids in a way that I never did before. And if you look at the posture of children these days, you can understand why it's starting to show up, that they have such weak extensor muscles. And so their posture is terrible. And they are actually having degenerative changes show up in 9-year-olds. Actually, 9% of 10-year-olds is the stat. 9% of 10-year-olds are actually showing up with degenerative change in their spine. So that, again, is way too much. And we've got to do something about that because it just is going to derail their life. I mean, low back pain derails everybody's life. It takes the fun out of things. Your fitness is affected, your productivity, your sleep, your energy, life is affected. And as ubiquitous as it is, what bothers me the most is it's almost totally reversible and it is completely, absolutely correctable. So to correct the problem, though, you have to understand the cause. And so that's why I'm so glad that you're here so that we can dive deep into this and you can really walk away really understanding what the causes are of low back pain. So to help you understand it better, I'm going to take you through a brief osseous anatomy lesson. We're going to talk about the suit of armor so you can better understand what the research tells us about the best strategy to bulletproof your low back. So here we have this is the pelvis that we're looking at from the front as though you're facing somebody. And so the ilium, if you put your hands on your hips, you're putting your hands right on the top of your ilium. And then between the ilium and the back of your spine is that triangular bone called the sacrum. And so that joint, in the two joints on either side of the sacrum and the ilium or the pelvis, those are the sacroiliac joints. So those are really important when it comes to low back pain. And then if we look at all the way around the circle in front, here's the pelvis. So this is the front of the pelvis here. And this joint right here, the symphysis pubis, I actually do find there are times when I need to adjust this area to help what's happening in the integrity of the whole pelvic brim and what's happening in the sacroiliac joints. And then sitting up on top of the sacrum, we can see the lumbar spine. And then, of course, the rest of the vertebrae are stacked right up on top, going right up the spine. And then we can see the discs here in between the bones of the vertebrae. And those discs are the spacers that keep the bones separated so that the nerves that come out from between the bones have plenty of room to breathe so they can carry the vital messages back and forth between the brain and the body. So in this side view, you can see the blue discs in between the bones of the spine, the lumbar vertebrae. And then you see the nerves coming out from between those bones. And so when we look at the lumbar spine, we have the neck, the thoracic, or the neck is the cervical spine. Thoracic is the mid-back where the ribs are attached. The lumbar spine is down at the waist, and then the sacrum sits right below that. So the lumbar sacral area, this is where commonly low back pain is experienced, along with what we don't see here is the pelvis, which would be blocking the sacrum if it was in this picture. So we have 5 lumbar vertebrae, L1, 2, 3, 4, and 5. And you'll notice that there's a gentle forward curve here. And so this forward curve is essential for the health of the lumbar spine because it's what provides the give in the spine. So we are not 4-legged, we are 2-legged. And as soon as we become 2-legged, as we're babies, we're crawling around, when a baby first just starts to figure out movement, they're on their bellies, they're kind of creeping, and then they just figure it out and they get up on all fours. And as soon as they get up on all fours, they drop that belly down and it just starts to create this beautiful lumbar curve so that when that baby is ready to sit up and to stand and be a 2-legged, it will have a curve in the lumbar spine. And that curve, again, is where the give in the spine is. So just like if you've learned about this neck and the cervical curve in the neck, also we want to have a forward curve. At the waist, we want to have a forward curve. So if you put your hand behind your back, right at your waist level, there should be a gentle forward curve there. Now, when I was growing up as a teen and a young adult, as women, we were coached to tuck our pelvis in, to flatten our stomach, because that was supposed to be what looked good. That was the wrong advice because that just straightens that curve right out. And now you just start to get jammy in your spine. So for some women that are troubled with low back pain as they're aging, they may have an old bad habit of tucking their pelvis in. And that straightens that lumbar curve. So the lumbar curve is so important here because of the give in the spine that it creates. Now, sometimes people talk about the discs as though they are cushions, but they're not. Or they talk about them as shock absorbers, but they're not. They're spacers. They're lousy shock absorbers. They're good spacers. And so if you are straightening this and you're putting the demand on them as if they were cushions or as if they were shock absorbers, they're going to wear down fast. So we want that curve in the spine to be the shock absorber. We want the shape of the spine, the biomechanics, to be the shock absorber, not the anatomy and the disc to do that. Let's look at the disc a little bit more carefully here. So when we look at the disc, what we see is that it has a center part, the nucleus pulposus, which is jelly-like, and then it has these fibrous fibers, rings around the outside. Now, this is an example of a disc that is breaking down, that these rings are breaking down, and that nucleus pulposus material is starting to put pressure and ooze out. Now, before it actually breaks right through here, you might have a bulging disc where there's just pressure that's pushing against the fibers, and the fibers are bulging against what might be a nerve coming out. So you can see on the side view here, the redness is that herniated disc. So there's a nucleus pulposus in the middle of that disc that's got pressure on it that's pushing out, and it's distending those fibers, and that can put pressure on the nerves, and that can interfere with the flow of messages going back and forth along those nerves. Now, for some people, this might create pain, but 50% of the people with bulging discs have no pain. So they've done studies looking at x-rays and MRIs, and they find that 50% of the people look like they have a bulging disc that would come along with all those symptoms, and they have no symptoms at all. And 50% of the people have no bulging disc, but they have all the symptoms of a bulging disc. So the value of the x-ray and the MRIs always comes along with the rest of the exam. What else can we discover in the exam that's going to help us understand what's going on? Because people can actually have a bulging disc and not have symptoms. So if that's true, how do we get the integrity, the function back as fast as possible, but over a long period of time? If you've got that bulging disc, if it's not symptomatic now, guess which direction it's heading? So we don't want to just say, then it must not be related, I don't have to do anything about it. Nope. We want to actually be proactive, that if you discover that you do have any bulging discs, even if you don't have pain, you want to go after that and restore the proper integrity to the spine so that that disc can suck right back in and you can get a healthier joint in there and healthier discs. Now, I want to just show you a little bit more about these discs, just a little bit more detail, because it'll help you understand the results that different people are going to get with the care that we provide. So the nucleus pulposus is right in the middle. That's the jelly-like stuff. The annulus fibrosus is around the edges, and you'll notice that there are layers in this annulus fibrosus. A lamella is another word for a layer. So there's one sheet and then the next sheet and the next sheet. But what's also happening is the direction of the fibers alternates. So the fibers are at a diagonal in each layer. You can see the diagonal that's showing up here. The next layer down is perpendicular in its diagonal. And then the next one after that is the same as the first. And the next one after that is the same as the second. So they alternate. And that means that you kind of had like a cross-hatching. And that cross-hatching is there to just maintain the integrity of the walls, the lamina, the lamella, the layers there, to maintain their integrity as best as possible. But what can happen is either the layers can get worn down, or from a trauma, there can be so much trauma, it can break those fibers and the disc can herniate out in a moment. Or more commonly, we're going to have chronic deterioration over time where we lose the integrity and the bulging happens and it continues, and the pressure is so great that those fibers just start to break down. And then over time, they lose their integrity and the nucleus pulposus can start to bulge right through. And then you can have things where that disc material actually is oozing out into the joint, and it can even break off or sequester and then just hang out there. So if it breaks off, well, you can't suck it back in. So it means that it's going to be time that your body's going to take to actually dissolve that away. Is once it bulges out and breaks off, it's no longer connected to that original disc. So there's very little blood supply in the disc, but it's going to now just deteriorate, and the body's going to ultimately over time is going to absorb it. But that takes a long time. So if you've got that sequestered piece that is pressing on a nerve, then it's going to take a while for that to reabsorb. The best practice here is to drop as much tension as possible in the spine so that we have the least amount of bulging pushing against it. And I'm going to show you that in just a few minutes. So with this nucleus pulposus in the middle and the fibers on the outside, there's one other thing that can happen besides the fibers breaking down, and that is that the fibers can actually just separate. And if the fibers separate, you can have that disc material bulge through, but it's still intact, and then you can suck it back in, and with rotation in the spine, it can actually help to realign those fibers so that the integrity can come right back very quickly. So when I have somebody that looks like they have a disc concern, There's some of that population that we're going to see a fast result because they just have a separation of the fibers. And then there are others that have a breaking down of those fibers where it's going to take longer because we're going to have to allow the disc to heal and to do as much as we can to suck it back in. Now, let's just talk about one other piece about the disc itself, and that is when you reach, I think I might be wrong exactly the age, but I think it's in the mid-20s. That's when you really no longer have a very good blood supply to the disc. So the way that the disc, which is still living tissue, the way it's going to get nutrients in and toxins out is a process called imbibition. So imbibition is kind of like the idea of a sponge. If you squeeze a sponge, the water comes out, and when you release it, it can suck the water back in. And so a disc is going to get nutrients in by releasing pressure, and it's going to get toxins out by putting pressure on it. That means movement is the most important thing to keep your discs healthy. Movement of the spine is the most important thing. And so if the integrity of your spine is dependent on the integrity of the discs, the movement of the spine is what the discs are dependent on. And so I really want you to think about even just the gentle movements, like if you do a circular motion with your hips, that's one of the best things for your discs. And so in our office, we have wobble seats that you might sit on in the reception area, and you're like, whoa, it's a little unsteady here. But that's exactly what it's supposed to be, because that's actually a way to keep your spine moving. You also know that I highly recommend using these pillows in your car or at your desk or on airplane rides, those kinds of things, because if you put it underneath you, it's going to keep your spine moving. If you ever saw anybody using a therapy ball or a physio ball sitting on that instead of on a chair for their desk, those are great because they keep the spine moving. So movement is so important because of that idea of imbibition. So movement of the spine is going to squeeze down and release, squeeze down and release. And that means you're going to get the nutrients going in and the toxins coming out. And that's how you keep that disc healthy. And if you don't do that and you're sedentary or you have spasms, so it's no longer moving, then it's going to cause a deterioration of that disc over time because it just isn't getting toxins out and it's not getting nutrients in. Imbibition, so key. And imbibition relies on movement. All right, so if you do have a disc problem, then that disc could be here, it could be pushing on the nerve and bulging out, and that could be uncomfortable. Even just the bulging of the disc can put a tug on the ligaments that are connecting these two vertebrae together. And so if you put pressure on the disc and it bulges out, then those ligaments are going to be stretched as they're attached to the vertebrae. And that stretching of the ligament from that bone is going to put stress on the bone, and your smart body is actually going to say, well, if there's more stress on that bone, we're going to have to build more bone there. And so you will build bone. And you can see in this lower one here, the edge is getting a little roughened. And that roughening is because the ligament that you don't see here, the ligament attached to it is tugging on that bone, and that bone is responding and starting to grow little spurs on the edges. Now, the other source of pain in the lumbar spine can be the facets. And so the facets are another part of the joint. So one part of the joint in the vertebrae is the disc, the joints here that use the disc. And then in the back of the spine, you have spinous processes that stick out. If you put your hand in the back of your spine, you'll feel those bumps. Those are the spinous processes that stick out. And then they are attached to these, the arthrosis, or the joint that goes right up and down the back of your spine. And so these are called facets. And so a facet is basically the surface of one bone's joint below, and then the bone that's articulating with it on the top has its facet, and so they join. And that facet is what the spine will rotate around. So if you are twisting your spine, that joint is going to have movement in that facet. If you bend forward and back, it's going to move across that facet. And then there's a capsular ligament. There's a ligament all around that, and there's fluid inside so that it can be a smooth run or a smooth movement, gliding movement in that capsule. So if that capsule gets inflamed, then that inflammation, it's going to secrete some inflammatory chemicals that can be irritating to the joint, and so that can cause pain and discomfort as well. So the facet joint syndrome can be another source of low back pain. Now, when we look at sciatica, sciatica is where the bones in the spine have become misaligned, and they are now interfering with the sciatic nerve, which is this nerve that is a bundle of many other nerve fibers, a huge bundle. And it's a very large nerve that goes right down through your buttocks and then down the back of your leg. And then it has branches that circulate around to the sides and the inside of your leg. And so if you ever have low back pain and you start to feel numbness on the inside of your thigh, and if you lose any bowel control or bladder control suddenly, that's really dangerous. And you want to go right to the emergency room because there's a part of your spine that's being affected that could really cause some long-term damage. So you want to, that's one symptom of losing bowel or bladder control. So incontinence coupled with, if you were sitting on a horse in a saddle, numbness in the inside of your legs. That's because the nerves that are coming out from there that are innervating that are coming right from the very bottom of the spine. Now, other than that, if you feel it in your buttocks or going down your leg or the outside of your leg or around your knee and so on, all the way down to the foot, that's classic sciatica. And it can cause pain, numbness, and tingling right all the way down into your legs and feet. So that sciatic nerve, when it radiates down into the leg, we call that radiculopathy. So you might have heard that word as well. And so remember that even though the pain is in the leg, it's not a leg problem, it's a back problem. And in fact, it's a spine problem. It's a disc and nerve problem. That's the cause of that. Now, occasionally you can also have the piriformis muscle that's going through this pelvis here, comes right across here. The psoas muscle comes across it in the front. So those muscles can spasm. That can put some stress onto that sciatic nerve as well. But even that spasming comes back to, well, why is it spasming? And it's going to be linked to subluxations or misalignments. It's still going to be a disc and nerve problem there. Okay. The lateral lumbar x-rays now are just giving you an idea of if you had x-rays taken, what are we looking at? So again, remember I said forward at the waist is going to be important, having a forward healthy curve. So this left-hand picture is the healthy normal, where you see the left is the back, the right is the front of the belly and the back. And so you see this forward curve here. And right behind the black line of the forward curve is right where the spinal cord runs and where the nerve roots are going to come out from between the vertebrae. So you can see where the disc space is in between the body of the vertebrae. And then in the back of the joint, that little bit of whiteness that you see coming right here, that's where those that's where the facets are that go around the joints in the back of the spine. Now, sometimes what can happen is you lose the integrity of that curve and it starts to straighten out. So you can see the edges of these vertebrae, they've straightened out. And then sometimes you can get this stair stepping where one vertebra is thrust forward. We call that that could be a spondylolisthesis when that happens. And I've seen spondylolisthesis where that vertebra has moved all the way forward right off the edge of the one below it, just sitting way down here. Incredible. And that person is still walking around and still doing their life. So it's amazing what the body can adapt to actually over time. Now, if you can see, it may be small for you, but if you can see and look closely here, the space in between the bones, of course, is where the discs are. And so this disc right here is a pretty good size. This one's narrowed. narrow disc right here, narrow disc right here. And then right here, we see some spurring on the front. So what has caused that spurring? It's that tug of the ligaments on the bones over time, and the bone's going to grow there. Now, if we look at an MRI, we're seeing the bones right here, the body of the vertebrae right here. And then you can see this is the spinal cord as it comes down inside. So it's like we're taking a slice right in the middle of the spine. So we wouldn't see any of the, for example, we wouldn't see any of the facet joints here. It's as though they've been cut away. So that's how an MRI works, is we can look at slices. And so when we look here, here's a healthy disc right here. And here's another one where it's intact. Well, what's happening right here? Do you see how that's bulging forward right into where the spinal cord is coming right down through the spinal canal? And another one right here, that's a bulging disc. And so at that point, we want to do everything we can to get this curve back in the lumbar spine so that we can actually relieve the pressure on that disc. And then things that can be done, sometimes people have traction done, sometimes people will have decompression done. And then in my office, I do approaches that are going to take the stress off of the spine that has compressed it down and just bring more ease and elongation naturally, so that once that elongation happens, just like a sponge that's being let go, it can create some pressure to suck the disc back in. All right. And so when we see what's happening there, now, whoops, where's my, let's see. How do I, there we go. So when we look at, again, what are the things that I notice and what is it that causes these symptoms? It's going to be anything that jars the spine, slips and falls and that kind of thing. Car accidents, sports injuries, so things that jar the spine, but also it's the things that just create stress in our lives. And what are the things that happen in between the jarring events? It's our bad habits, poor posture, screen time, sedentary lifestyle, sitting too much. Those are the things. And what I notice is that when people come in to see me, in the teens, people, young kids, they're invincible. So they're going to bash their spine around. They're going to have terrible posture, and then they might start to feel something. So, I might see them in their teens talking about some low back pain, but, they just keep going and going. Then in their 20s, they've had 15 years of school and sitting behind them, and they start to talk about the occasional tweak that happens because of some kind of event like the sports injury or something like that. And then in their 30s, people are starting to get deconditioned. They're not as active. They're kind of strapped to a desk all the time. And so if they're less active, there is less stability in their spine. And so, but they still think and act on weekends like they're in their 20s. So they will report occasional tweaks now and then, usually associated with like overdoing it on the weekend, and occasional stiffness and pain, if they worked out too hard, and they recover fast, and they have a tweak and that kind of thing. And the usual answer is just, apply heat and pop some pills and you're good. But then in their 40s, now that sedentary lifestyle, maybe there's some obesity happening now. They're overweight, they're deconditioned, and now degeneration is underway. And the structure is weakening, and now the back is going out on them occasionally, and they just push through it and ignore it, maybe take more pills. It just takes a few more pills now. And then in their 50s, now their back is going out more than they do. So they're living around the problem. They stop doing the things that they love to do. They no longer exercise. They just pop pills. They're just stifling their physiology, and they're going to need stronger and stronger drugs. And next thing you know, physical therapy, then surgery, and, you all know about the opioid crisis. Well, the most common cause of opioid addiction is getting on painkillers for low back pain. And then that slippery slope of where that leads. Then people are in their 60s, and now they have this severe degeneration that may be happening, and more weakness, and their nervous system compromised, and they have more drugs and surgeries, and And it's what we call adult FAS, adult falling apart syndrome is happening. And so, let me know, like, give me a thumbs up if you recognize other people in your life that fit into these categories, right? We see it all the time. So it's not a mystery of how this all unfolds. But there are other options that are out there. And so what can we do? Well, what are the options besides chiropractic care, which of course I'm going to talk about? Let's look at the allopathic traditional medication, what that world offers. So first off, oh, you're injured yourself, put some heat on it and some bed rest. Well, bed rest is probably not the best option. Maybe for a couple days in a very acute new injury, you just have to take your load off of your feet. But within a few days, we actually want movement to start happening, because otherwise, if you're on bed rest, what's going to happen to that imbibition? Without movement, it's going to start to move that disc towards degenerative change. And so yeah, just bed rest, may be a good first option, but definitely not going to be a good long-term option here. And then when it comes to the drugs, well, what about the drugs? We've definitely got a crisis happening here when it comes to the drugs. And we know that that's a slippery slope of where that's all heading. But if we look at what the stats show us, I just want to look at one other thing here and see if I want to cover what I want to cover here. I want to just go through all these options first before I then go into a little bit deeper dive on the drugs. So physical therapy, actually there was a study that was done, I think it was last year. So it's a new study, and it showed that the people that went to physical therapy ended up going on more drugs, and were on track with more likely go to surgery versus people that had chiropractic care. So again, it's kind of similar study, but on this one, they were looking at drug use, and much more likely, like it was something like 80% of the people that went to physical therapy were likely to also be on some sort of medication, versus the folks that were going for chiropractic care, and it was low, maybe 20%, something like that. So definitely a distinction there. So physical therapy is, that can be useful, and it has its intent of working with the muscles and so on. But if it's not actually correcting the subluxations and the cause, then it's going to have some limited benefit. The steroid injections, again, we just saw that latest article said that is one of the last, you do not want to be doing that for low back pain. And then by the time people are looking at pain management, well, they've already given up. Like all they're trying to do is just manage that pain. They've already come to an endpoint where they don't see any other way out. And then the surgery, of course, failed back surgeries are a very common occurrence. And so, you might get lucky and have some relief from it, but it's always kind of a red herring when somebody comes in and they've had surgery, because I'm not actually sure what exactly did they do in that surgery. They said they did one thing, but what actually did they do? So, and then we can look at alternatives here. So how bad is it with the drugs and with the allopathic approach? Well, this is just showing the study of the use of these oxycodone, morphine, fentanyl, all of those kinds of things. And so what we can see here is that there's been an increase in the legal narcotic production from 2008 to 2016. You can just see it going up. But what you also notice is, there's also a rise in fentanyl is a drug that they might use also just as a legal drug as well. But these are very powerful, highly addictive, prescription-only hardcore pain pills. And the common names, again, OxyContin, Percocet, Vicodin, those kinds of things. They are the #1 selling drug class in America, even more than statin drugs and anti-anxiety medications, which are pretty high up there. And how many people know people on statins and anti-anxiety drugs, but nobody talks about the opioid addictions that are out there. So how do we prevent this? Well, we have to actually, again, just understand how widespread is it. And when I looked closely at this data, like, okay, this is something that's really scary here. So these are in each state, the number of opioid prescriptions per person. And so you'll notice, like in the color coding here, the green is 52 to 63% of people have some sort of opioid. The number of opioid prescriptions would be about 52 to 63% of that population. And then the yellow is 65 to 82%. But hang on now. You're getting into 100%, and now you're getting over 100%. So these red states and the dark orange states, that means that there's more opioid prescriptions than there are people in that state. Okay, so what is happening there, right? We are upside down here. All right, so, and if we look at, just looking at this infographic, 40 people per day are dying from narcotic prescription overdoses. And, and this hits home to a lot of people. Like I have a cousin, and she had chronic low back pain. She lived in Massachusetts, not near me. She had spinal surgery, and she was in her 30s, late 30s, and she was managing it with morphine patches. So she would put a morphine patch on, and then when it all was used up, she'd take that one off, and then she'd put another one on someplace else. And when that was done, she'd peel that off and put another one on someplace else. Well, one day, her 10-year-old daughter climbed into bed with her, and she was dead because she didn't take off one of the patches and just put a new one on, and she overdosed on morphine. So that's right in my family. And so this hits close to home for a lot of people. And so it was just an overdose. And so right now, if we look at this infographic, enough painkillers to medicate every US adult around the clock for a month. What are the consequences of this as our strategy? Well, overdose deaths involving opioids, cocaine, and heroin. So we're looking at the prescription medications, and then you see what happens in 2006. So the heroin, cocaine, and opioid analgesics. You can see how the opioid analgesics just go straight up like a shot. You can see that the cocaine use went down, but what went up? The opioid analgesic use went up. It replaced the cocaine. But you'll see even here, the heroin went up, and that's because they started to get more strict about who had access to these opioids. And when the prescriptions were blocked, where did those people go that were addicted? They went to the street drugs, and then they started to go towards that and fentanyl. So Vermont leads the country in fentanyl use and opioid addictions. So we got some trouble right here at home. Who's seen these kinds of, headlines and back pain, painkillers, horror stories, opiate addictions, right? So we have a drug culture instead of a healthcare system, is what we find. We have a drug culture instead of a healthcare system. People are taught that drugs are the first and best choice for managing their health. And yet for every problem, there's a pill, but every pill is going to have a problem that comes with it. So for every pain, there's a drug. But, is there a place for these? Absolutely. But for long-term health, absolutely not. And so again, if we just look at what the studies show us, here's the study I was mentioning. So with physical therapy and chiropractic care, with low back pain use, with chiropractic, there was a lowering of opioids by 55% versus with PT, it increased the opioid use up to 90%. So again, let's move this over here. So chiropractic care was the care that lowered the opioid use. Physical therapy was the care that increased it. And so again, what are the allopathic options? We've looked at all those. Let's look at surgery now. What does that look like? Is that a good idea? Is that is that the direction that you want to go in? Well, it's incredibly expensive and it's potentially dangerous. And again, if you just start to go back to the safety and the efficacy of any any option that you're given, you want to be asking the questions: how safe is it and how effective is it? And so what does the research say about it? And so research about surgery, spinal fusion surgery, It's limited results when treating degenerative joint disease with low back pain. It increased from 1990 to 2001 by 220%. And then the evidence just was not there that it was going to be good, and the outcomes were worse and worse. And so since then, it has decreased. And now there's new spinal fusion techniques and device implants, and those have an increased risk of nerve injury, of blood loss, of other complications, operative times, repeat surgeries. They do not result in improved disability or reoperation rates. So again, just looking at the research, is it effective? And not necessarily so. When you look at the back surgery, is it the best option? What actually is happening in back surgery? What are they doing? And literally, this is what it looks like. They're putting metal devices in to try and fuse vertebrae. They will, and I've had people that come in. I saw a guy once who he had scoliosis and had a Harrington rod put in, and the body was so strong and powerful that the scoliosis just continued, and he had these bumps sticking out through, not right through the skin, but pushing, stretching the skin out. It was the screws. They were literally right under the skin. So that's how powerful the body is. So, we really do have the worst track record with back surgery. I mean, replacing knees and hips, we're doing okay, but not so with the spine. You're going in, you're ripping someone's spine open and fusing or taking out discs, and all that is right next to that delicate nerve tissue in the spinal cord. So it's much more complex. It's extremely intrusive. By the time we get to surgery, it's considered the last option. And in the 80s, the research showed 33% of disc bulges with sciatica had surgery. 10 years later, 65% had a relapse, and they called it failed back surgery syndrome. So then they reduced it, so now it's only 7%. So they really are trying not to go towards surgery for people because it just wasn't safe and it wasn't effective. All right, so not necessarily the best option here. Okay, but how many here would like to hear what's a better way, right? So again, just look at the results with chiropractic care. So this was a study that what they looked at in this study was just overall health care. They gave people the option that for their insurance, this was Blue Cross Blue Shield of Illinois, you could choose to either have a chiropractor as your primary care physician or a medical doctor the regular way. And so they followed the data over 7 years, and they had 70,000 member months that they were able to look at. And what they found was the group that chose chiropractors had a decrease of 60% of people having to go right into the hospital, being admitted into the hospital. They had a decrease of 59% of days spent in the hospital if they did have to get admitted. They had a decrease of 62% outpatient surgeries and procedures, and a decrease of 85% pharmaceutical costs. And that means less pharmaceutical use. So when it was compared to the conventional medical intervention. So, and this was a study back in 2007, and the results are the same as we move forward in time. We're still seeing those kinds of results clinically. So again, these are the symptoms that show up, and these symptoms, any symptom is a signal. We call it body signals, because it's your body trying to get your attention, trying to tell you you're moving away from health right now. And so in our culture, of course, the tradition in our culture is just to mask that, just don't feel it anymore with medications, or just don't do so much, just tolerate that, just live around it. And so really it's your body wanting you to make a change. And if you can learn how to speak body language and understand what your body's trying to tell you, and then you can listen to it and respond to help your body, if you realize that your body is asking you to make a change, and you could say, well, what change could I make that could add health here, rather than just trying to take away a symptom? So that's the question I would like to have you ask yourself. If you struggle with low back pain, where do I need to build health? If this is my body telling me I need to make a change, where do I need to add more health here? And again, when it starts to affect your life is when you start to pay the most attention. So if it's painful, but you're able to do everything, people don't pay as much attention, but I want you to pay attention, even if you can do everything, because it's still your body trying to communicate with you that you need to make a change. And so a body, and by the way, if you are struggling with low back pain, with any of these things, or you know somebody that is, I'd love to just sit down and talk it through with you. So feel free to just text my team at our number, 802-985-9850. And it just puts some sort of phrase in there like low back pain consult. And we can set up a 10-minute call where I can just understand what are the nuances in your case, what's going on for you, what are you challenged with, and then I can see if I can help. So feel free to do that. But as I said, any of these symptoms, these are body signals, and these signals are the tip of the iceberg. So the way you think about the symptoms is going to drive your choices, which is what's going to drive your outcomes. So again, I just want you to think about, this is your body talking to you. And if we think about symptoms where do they fall in a continuum? So they tell us in what direction we're headed. If you look at this illness wellness continuum, I can orient you. Whoops, let me go back up here. The left side is where you're losing function, heading towards premature death and early death. The right side is high function, robust levels of health. So there's like a dichotomy here on either side. There's a polarity here of sickness and health. But I want you to recognize there's something in the middle, which is the neutral point, where there's not really symptoms, but it's not the same as robust health. And so this is the healthy zone on the right side. This is the sick zone on the left side. Well, the middle is the not sick zone. The not sick zone is also the not healthy zone, but it's before really any symptoms show up. And the first thing that shows up is signs, things that you can measure, but maybe not a symptom. And if you don't pay attention and make changes when those signs start to show up, then you start to move into symptoms. And if you can't address the symptoms and you lose more and more function, now you're moving into disability where those symptoms are no longer correctable. So this is a moving in a direction that I want you to get from this. And when you have symptoms, they tell you you're moving away from health. You're moving away from health towards disability, towards early death. You're losing function. And you could mask those symptoms. You could take a medication. And then, as Dr. Marcia Angel said, she was the editor of the New England Journal of Medicine for about 20 years. Imagine the research that passed in front of her. She said, you can never medicate your way out of a situation you behaved your way into. You'll just feel better as you're getting worse. So as you move further along to the left, you're losing function. Now, in our model of healthcare, our current conventional model, the treatment paradigm will bring you right up to the neutral point, which is not the healthy zone, it's the not sick zone. So it's up to us to really understand this so that we can keep ourselves moving beyond that and really do things that are going to build health, build function, get you moving in the direction you want to be moving in to that high level of wellness. All right. And so one other thing that's really important to understand about the nervous system is that when you feel pain, it's only certain nerve fibers that feel pain. So if we look at an entire nerve that is a bundle of nerve fibers, within those nerve fibers, there's a certain percentage that feel pain, but it's only 7% of the nervous system that feels pain. The other 93% of the nervous system is running things. It's running the muscles and running the organs. So if you have interference with the sensory nerves, you might feel pain from that. But it might also affect your posture in that you may start to lose track of where your body's in space. So you might feel like you're standing upright, but you're actually not. You might have some altered sensations for not really perceiving hot and cold as accurately and that sort of thing. So that's all having to do with the sensory nerves. But if the motor nerves are affected, it might start to show up as weakness or spasms or fatigue or tightness. And if the autonomic nerves are affected, that's for controlling the automatic functions in the body. You might have trouble with your sinuses or allergies or low energy or digestive problems or breathing problems, or think of any organ. When that organ loses function and you start to have problems, the autonomic nerves are what are controlling the function of the organs. So the nervous system is the master system. It controls every other function in the body. And so if we interfere with the nervous system, 10% of the time, it's actually 7%, but just round up. 10% of the time when you're feeling pain, it's because just those sensory nerves are being affected. It means that you could have altered function in the motor nerves or the autonomic nerves and not feel pain. So then you wouldn't know that it was there. So it's kind of like a cavity that you could have interference in your nervous system and not feel it. The same way you could have a cavity and not feel it. By the time you're feeling the cavity, it's already been there a while, and now it's starting to hit the nerve. So just understanding feeling versus function, because a lot of people will say, I feel good, or I feel back pain. I felt back pain yesterday, but I feel good today. I think I'm okay. So what if you felt the pain yesterday because it was jamming on that sensory nerve, but today it's jamming on the motor nerve or the autonomic nerve, which you don't feel. So we have to be very careful about just relying on how we feel to determine how healthy we are. And now if we look at the nervous system itself and how the nervous system is protected by the spine. So nervous system is going to consist of the brain and the spinal cord, and then the branches coming off of that go out to all the different parts of the body. And so we have our skull, which is the helmet that protects our brain. And then we have the spinal column, which is the suit of armor that's protecting the spinal cord as it goes right down the spine. And again, you can see here a beautiful forward curve in that lumbar spine right at the waist. Beautiful forward curve in that cervical spine. Now, all the nerves that come out, there's a map to the nervous system here. And so these nerves are going to go to control different things, and we know exactly where they go. So at the very top of the spine, that could affect things, all these organs here. And if there's tension at the top of the spine, 90% of the time, if there's tension here, let me say that differently. When there's chronic low back pain, 90% of the time, I find a pattern at the top of the spine. Because look, this is a spinal cord that is one unit going all the way down the spine. And if there's trouble here, the brain says, whoa, brainstem is more important than the lower part of the spine. So if I have a tug at the brainstem level, I just want to get that tug off of that brainstem. So maybe I could actually just get rid of a disc down here to bring the bottom of the spine closer up, to relieve some of the tension and stress that's pulling on that spinal cord. So 90% of the time of chronic low back concerns that are not changing, I find an upper cervical pattern. So I'm always going to look at that as well. But you can see the spine is kind of like a circuit breaker. And these nerves are going out to not rooms in the house, but organ systems and muscle systems, muscle areas of the body. So the nerves that come out of the low back are controlling the muscles in the buttocks and in the legs and so on. Now, there are ways that we can measure this. And so if we look at this bottom right-hand corner, this is one of the scans that we do in our office where we're measuring nerve supply to the muscles. So we can literally see if those muscles are overactive, they're in spasm mode. And we can then know how we can address it, and we can measure it over time and see that it actually is improving. But this is all signs of a stress response. For example, in a circuit breaker down in your basement, if a circuit blows, what causes that circuit to blow? It's not random. It's only going to happen if something overloads that system. And the same thing is true when you have subluxations or nerve interference, misalignments of the vertebrae in the spine. That interference is going to be the result of an overload of some sort, whether it's a jarring of the spine or in between those events where there's ongoing stress that's happening. And so what does stress look like? A stress response, we're going to have, think of, if a tiger was chasing you, what would you want your body to do? That's what a stress response is. It's an adaptive physiology. So our blood pressure will go up, our heart rate goes up, our muscle tone increases, we get more tense. Digestion gets upset, so that at first we're going to just empty the digestive system one end or the other, and then we're just going to quiet it right down, and we're going to down-regulate digestion in a stress time. Reproduction and sex drive, that also is down-regulated. Not a good time to make babies if your tiger is chasing you. Decreased serotonin levels, not a good time to go to sleep if the tiger's chasing you. Increased sensory systems, you're in alert mode. Fear and anxiety are ramped up. Your immune response is also going to be down-regulated because it's such an expensive system to run. So when you are in stress response, which should only last a few minutes while that tiger's chasing you, and then it should be done. And then you're ready to bring that immune system right back online. But during a stress response, immune system is down-regulated. Insulin sensitivity is also down-regulated because we actually want the blood sugar to go up, because that blood sugar is that instant fuel that the muscles can use to run or fight as fast as you can. You're also going to decrease the HDL and increase the LDL cholesterol. So those two lipids they're going to reverse. The reason for that is that the LDL cholesterol is what we use for repairing injuries, repairing wounds. And so if you're in a stress response, chances are tiger's chasing you, you might be wounded soon. So better have that cholesterol, that LDL ready to go to repair the wound. We also use the LDL cholesterol to create stress hormones, cortisol. And so we need cholesterol to create the hormones. And so that's why, another reason why it goes up when we're stressed. And the same reason clotting factors will also go up for that same reason. So it's important to understand what is causing all this. But before we do that, let's review the most important premises that we want to work from here. So first premise is that healthy is normal, unhealthy is abnormal. Back pain is abnormal, especially if it persists. Now, if you have an injury, okay, you injured yourself, you got wounded, you've got some healing to happen. But if it doesn't heal up, something's getting in the way, and that's not normal. So chronic low back pain, it may be common, but it's not normal. We're normalizing it, but it's not. So we want to start from that premise that healthy is normal, unhealthy is abnormal. And the second premise is that your body is smart. It was designed to be healthy. Every cell is always trying to move towards health. And so if that's the design and you're not experiencing health, something's getting in the way. So we just have to reconcile, well, what's getting in the way? It's only going to be one thing, interference. And it's only two things that can create interference, toxicity or deficiency or both. So too much movement, too little movement, or both. You know, you have both, sedentary and weekend warrior. Or could be toxins. It could be chemical toxicity. You know, eating inflammatory foods, too much, not enough, deficiency in nutrients, toxicities and deficiencies, right? So you want to be thinking in that direction. Now, the nervous system is the master system because it's in charge of running everything in your body. Every tissue cell in your body, all those muscles in the lower back, they're all connected to the nervous system. Every tissue cell has a range of 3 to 9 nerve fibers going to it to control it. So everywhere you can think of where you are, your nervous system is there. We are literally living our lives through our nervous system. So the nervous system is the master system. And then the spine is the suit of armor that is protecting your spine, your nervous system. Now, modern life, it's unnaturally stressful. Like it couldn't have been engineered to be more unnaturally stressful. And how many people would agree that stress can make you sick? Right? We all, yeah, get the thumbs up. We all know that's true. And in this modern world, again, stress is becoming normalized, but it's that unnatural stress that keeps damaging our spine and our bodies. So where are those sources of stress? It's coming at us from 3 dimensions, thoughts, toxins, and traumas. So it's not just the physical stresses, it's the mental, emotional stresses, the chemical stresses, and the physical stresses, including being too sedentary as one of the physical stresses. And there's the big events that occur in these categories, the one-off events that happen now and then, but in between those events, it's the disorganization and deadlines and chaos that's stressful for us in our thoughts. It's the poor food choices that we make that are those low-level toxins that are coming along on a consistent basis. And then the sedentary lifestyle that's happening. So certainly there are the macro traumas that can occur that can jar the spine, that can cause an injury, that can lead to low back pain, subluxations, and so on. But it can also just come from just doing things, but maybe doing them the wrong way, or even worse, slips and falls. And then we have the posture problem. So the posture problem actually is more of a concern to me than any of these events that can occur. And the reason is because we find that, yeah, we end up having to just deal with our life, and our life's demands are that we're on devices way too much, or we're, carrying backpacks and kids, and we're just not using good ergonomics when we're doing gardening or when we're sitting, or the world just doesn't fit us, right? So those are all the different things that are the micro versions of these stresses that can occur. Sitting is the new smoking, and sitting in front of a screen, well, screens are the new crack cocaine, as they say. So again, it's just bad for our bodies. It's bad for our organs. It's bad for our spines to be sitting as much as we are. And all of these stresses cause something called subluxation, where there's a joint misalignment that causes soft tissue damage. That soft tissue damage leads to inflammation and nerve irritation. The nerve irritation causes muscle spasm and pain. It's your smart body trying to reduce the irritation to the nerve. And so that joint, that if it moves, it's going to continue to irritate the nerve. Your smart body will spasm that joint, spasm the muscles around that joint to immobilize that joint so it doesn't move as it's trying to deal with the pain and the nerve irritation. But then again, when we strap down that joint and it no longer moves, now we're going to get that lost inhibition. That's going to start to affect the discs and that joint fixation. So movement deficiency syndrome is one of the factors that can contribute to low back pain. And it's really something that low back pain can be linked to a toxic global physiology, because when we are losing that inhibition, when we're losing that motion in the spine, then the brain starts to just go into a stress mode for the whole body. And so again, it's the feeling versus function. So what do we need to do to address this? So there are things that we need to stop doing, things we need to slow down from doing, and things we need to start doing. So let's dive right into this if we're going to correct these issues and end your back pain and prevent it from ever reoccurring again. Like, who wants that? Well, anybody that wants that is going to need to do some things. So we use a three-legged stool model when we help people: adjustments in a rhythm, breaking the bad habits, and doing spinal exercises that can strengthen the spine. So when you look at long-term chiropractic studies, they actually show that telomeres, which are on the ends of your genes, the longer the telomeres are, the longer your life seems to be. And so if it shortens, it means that we're aging. And over 2 years, folks that are under long-term chiropractic care actually had an increase in the DNA marker that showed how well their telomeres were being repaired. And so explains why people reporting reversing the effects of aging, and each adjustment in rhythm is a cumulative benefit that leads to the best results. So what I want to do is I want to just go through the stopping the bad habits, adding specific core exercises, and then again, just talking about specific chiropractic adjustments. And in the past, when we've done this in person, we actually cycle through different stations, but I'm just going to cover it all here, and then you'll have what you need right where you are. So when we talk about adjustments in rhythm and corrective care, there's a momentum, there's a cumulative benefit, and the healing process is it is multiplied as you have consistent care. Corrective care, that's the kind of chiropractic that we do at our office. There is palliative chiropractic care out there for people that want to just, help somebody. Oh, my back hurts. Here, let's adjust you. Your back feels better. Okay, just come back when it hurts again. That's crisis kind of treatment. It's using chiropractic almost the way you would use a drug. And so it does help people get out of crisis without using drugs. And it's natural and better than using drugs, but it's not correcting the cause of the problem. So corrective care helps you get out of the fire, but it also corrects the cause and helps you stay there. So we want to really make sure that we're making that correction and living a healthier lifestyle so we don't keep recreating it as well. So adjustments in rhythm, it really helps it resets our healing rhythm, and over time builds momentum, and there's an accumulating healing effect to it. And it also acts as a hormonal reboot. So when you get an adjustment, your cortisol levels will downregulate, and it kind of resets you out of stress mode into healing mode. back to that feel good endorphin kind of feeling of neuroendocrine hormones. And the oxytocin, the bonding, the anandamide, which is the bliss hormone, right? So all those things actually flood your system with chiropractic care versus the cortisol stress hormones that are flooding your system otherwise. Sometimes people may have flare-ups, but if they have regular care, they correct more easily. And people that only get adjusted when there is a flare-up, they're harder to correct over time. And they can have degenerative change that's continuing between those visits of flare-ups. And so over time, it can be harder and harder to correct. So that's the chiropractic care, the corrective care part. So if you're already under chiropractic care, talk to your chiropractor about shifting from palliative to corrective care if you have not been using it that way. If you're curious about what we do here, of course, again, just text our team and we can sit down and have a conversation. Now I want to just talk about the muscles in the spine so that you can see how this part works. So when we're resetting segments that affect the muscles around the spine, it's the deep core muscles around each vertebrae, the rotators and the transverse muscles that they can go into a nice muscle relaxation response with chiropractic adjustments. And the more relaxed the nervous system muscles are, the healthier the body is. So we can actually use the surface EMG to measure that. When you come into the office, that one scan that I showed you that had the bars, that's the surface EMG. So that's how we measure what are these muscles doing along the spine. One thing I do want to mention is that if you do have a sacroiliac instability, one thing that we can do is give you a sacroiliac belt that goes right around the sacroiliac joints. And what that does is it creates the stability here so that these muscles up above can start to relax and don't have to be on guard. The multifidus muscles are involuntary muscles, and all the other muscles along the spine are the voluntary muscles. So we can choose what we're doing with these, but the multifidus we don't choose. They are involuntary responses, and those are the muscles that can trigger a subluxation and then just hold on to that subluxation. So when we do the work in our office, we do a light touch model, and that light touch along the spine helps the brain to see what all of those muscles are doing and where the alignment is, where the lack of alignment is. It helps the brain to get a more accurate picture of what's happening in that area, so it can actually start to run that area in a more efficient and a healthier way. So I'm just looking at my notes here. Oh yeah, one other thing is that when there are disc herniations, there's that stress, that's that spasm that's happening where these muscles are spasmed and they're pushing the vertebrae together, and that can put pressure on the disc so it bulges out. So there are some traction exercises called the McKenzie traction exercises that you can also do to help to just expand the distance between the vertebrae so that there's more of a chance of that disc to get sucked in rather than the compression that can cause that disc to bulge out. And then also just using those supports for your spine, the back vitalizers that we have here in the office whenever you're doing anything. And so now if we look at some of the other spinal exercises that you can do. So when to do which exercises and when, that's always a good question to ask. And so with the sacroiliac, we want to be doing exercises that help this sacroiliac joint, but also the psoas muscle is a big one for the sacroiliac. So the psoas muscle runs from the back of the spine around to the front and down into the kind of like the groin area. So lunges are a really good exercise for stretching out that psoas muscle. Doing a lunge, you can, and if you have trouble like actually putting one leg out in front, bending the knee and having the other leg extended behind you, if you have trouble with that, you can actually do that sitting in a chair. So just sit on the edge of the chair, on the side of the chair, and just stretch one leg back behind the chair, and then you're doing a lunge. So you can do it seated. You could also work with a physio ball and sit on it that way and just stretch one leg back. You could literally even lay on your bed on your back and just drop your leg off the side of the bed. That's another way that you can stretch the psoas muscles. So depending on what's going on, if someone has sacroiliac instability, if somebody has a disc trouble, if somebody has the facet concerns, depending on what's going on, I'm going to give them different exercises. And so again, for the disc, the mini Mackenzie traction can be helpful. For the sacroiliac, also the windshield wiper exercise. So at night when you go to sleep, when you lay on your back, just turn your toes in and out like windshield wipers. And that will actually pump the sacroiliac joint all the way up in your hips. And then in the morning, before you get weight bearing, lay on your back and do that one more time. Do about 20 windshield wipers back and forth. And then using that SI belt again is key also. So now if we look at 4 aspects of taking care of the spine, the spinal assessment is key, and warm up and cool down and flexibility, and then core strengthening. Let's go through each one of these. So for the spinal assessment, we use instrumentation like the surface EMG, measuring the nerve supply to the muscles. We also do the rolling thermal scan, thermography, that measures the nerve supply to the organs. We also will do range of motion tests, so we can see, is there a restriction in motion in the joints? And then I'll even feel the spine and feel for the give in the spine. That's another type of motion palpation. Is there give in that joint? And if that muscle is strapped down, when we come to that joint, it's going to be stuck. It's not going to have that give to it. So that's the motion palpation. The static palpation is just feeling, is that vertebra in alignment? Is it posterior? Is it sticking out the way it shouldn't? Is it rotated the way it shouldn't be? So just feeling the positioning of the vertebrae. And then looking at the posture is really useful as well. So looking at, is the head over the shoulders, shoulders over the hips, hips over the ankles? Or is one shoulder higher than the other? Is there a tilt? Are the hips tilted? Are the hips rotated? So we can actually see a lot about what's happening in the spine from looking at the posture. And then, of course, x-rays can tell us exactly what's going on as far as any degenerative changes that are occurring there, any abnormal physiology that we want to take in a note of. Are there any congenital malformations that you were born with? That is something that we have to just know is part of what your makeup is, and we have to accommodate that. So those are all the ways that we will identify if you have a subluxation. And then if you do, as we correct those subluxations, we can then measure how it's improving. So again, if you're not sure if you have subluxations and you want to get checked, just text our office and we can get you scheduled in. All right, so now the 4 aspects, again, we've done the spinal assessment. Now let's look at, how about the low back? What are good things to do for warming up and cooling down and for overall flexibility? If you are going to do some strengthening exercises, what you want to do before and after doing those core strengthening exercises, and then just overall good practice. So it's the squat. Squatting is the best warm up, the best cool down, and the best way to gain flexibility. And so toddlers automatically know how to do awesome squats. And so as adults, we start to get a little stiff, and we don't have that same flexibility. And so we might do squats the wrong way, and then they can be harmful to us. So the right way to do a squat, if you were able to do the full squat, you're going to have your strong lumbars are going to be engaged here. You're going to have this crease at the hips, and the hips are going to drop below the knees. So not just parallel to the ground, but below parallel. You're going to have your weight on your heels. The feet are going to be shoulder width apart. You might even lift your toes up as you're doing your squat to make sure that the weight is all the way on the heels. The knees should be tracking over, but not beyond, not out in front of the toes. So just over the toes. And then the torso should be upright, and then the noggin in neutral position. So the head should be, right up in line with the spine. So that's the healthy way to do a squat. Now, if you can't accomplish this yet, then you can just start by just slowly squatting down towards a chair. And so that's one thing I'd like to recommend that you do, is especially if you can't do a good squat and your leg muscles feel weak, to strengthen them, a very simple thing to do is that every time you go to sit down as slowly as you can. And when you get up from sitting down, get up as slowly as you can. When you move slowly sitting down, you're going to engage those leg muscles and start to make them stronger. So you can start by just doing that, just squatting down to a chair and then standing up from a chair slowly. And then as you start to get more flexibility, you can start to go against a wall and squat down, or you can squat down onto a physio ball, something that's a little bit lower, and so on. And then over time, if you can get your squat lower and lower, that's where you're going to get the most flexibility that's going to be the most supportive for your spine. So again, that flexibility is key, and having good form as you do it. So make sure you're doing it mindfully. All right. And now, once you've done your warm up, here are some core strengthening exercises. Again, even just standing posture, this is something you should be doing all the time. That's that inner corset exercise. So remember that the way that works is you're going to put your arms up over your head as though you're holding a laundry basket above your head. And when you do that, that's going to lift up everything in your abdomen. It's going to lift everything up. So when you feel that lift up, then you can just put the arms down, but keep that lifted up. And then you're going to lift the tailbone up and back so that you can feel the weight going into the heels. And then the last part of it, and you should be engaging the muscles right at the base of your sacrum and the low back. You should feel those engaged as you lift that tailbone up. Keep working there, and then just take the front of your ribs and just a little millimeter, just tighten them down, the front of your ribs, just tighten it down towards your pelvis, just so you now have a corset. You can feel your whole corset around you engaged. So anytime you stand, keep coming back to that. That's a fantastic way to just get core strengthening done all day long. Now, there's another set of exercises called the foundation training. This is taught by Dr. Eric Goodman. He developed this work, and that's where you are learning how to bend properly, and you're getting a lot of elongation both in the front of your torso, and also you're having a nice stretch in the hamstrings. So the foundation exercises basically is teaching you how to bend. And so for bending, you're going to just stretch your arms out in front of you as you push your butt and your tailbone back behind you. And as you lift that tailbone up, you can feel the stretch in the hamstrings. There should not be very much bend in your knees when you're doing this. The knee should be close to straight, but not locked. That's the foundation training. If you're in my practice, I can give you some specific videos to watch that are Dr. Eric Goodman's work that I love referring people to. Now, for the sacroiliac exercises, there's a version 1 of that, level 1, which is all about working with the piriformis muscle in your butt and making sure that stretches out nicely. So laying on your back and bending one knee up and then rotating it around across your body so you get a nice little twist in there, and then repeating the same thing on the other side. Those kinds of exercises. The second level is doing those lunges that we talked about. And then a third level is being prone, meaning laying face down and lifting your legs up and lifting your arms up. So that really engages that whole exterior chain, that physiological chain in the back of the head, all the way down the back of the spine, all the way down the legs, that posterior kinetic chain. Now, another really great core strengthening exercise is a plank. Planks are awesome for gaining that core strength. And so a plank is simply as if you're doing a push-up, but you're just in a still position. So you can either be on your hands, or you can be on your fists, or you can be on your elbows. And then it's just holding your whole body straight as you're down on the ground, face down, but you're up on your elbows and your toes, elbows and toes. You can be elbows and knees if you're starting from the beginning. That's still going to help to strengthen that core. And then as you get better at it, you can be up on your toes. Now, a good practice to shoot for is being able to do a 2-minute plank. A 2-minute plank. Just get up on those elbows and just be able to hold that for a full 2 minutes with good form. Don't let your belly sink down. Don't have your butt up in the air. Try to be as straight as possible. And that's actually correlated with longevity. So people that can do a 2-minute plank correlates with a longer life. I have a lot of fun. Like there are many different things that you can do that are tied to that, but the plank is one of the ones that we're talking about today. Now, for core strengthening level 2, once you're good at all of those, then you can do a plank on the move. So that's where you're down on your elbows, but now you're going to lift up one arm and stretch it up behind you with a twist. So you're moving out of that plank and then coming back down, and then you can do the other side. And so planks where you're starting to move a bit. You can do a plank on a physio ball. So you're actually leaning right against the physio ball. That's harder to do because that ball can move. And so one thing you can do is you can actually trace shapes or letters while you're on that physio ball. And that's another great way to just add more core strength. And then you can actually participate in programs with CrossFit or Pilates or yoga, all other ways at level 2, but start with these foundational pieces first to get into shape so that then you can get the full benefit of that level 2 core strengthening. And if you're really out of shape, you can't do a plank, you can't do anything, I just want you to start by just doing as simple as, just sitting on a physio ball and getting some movement in your discs, and then trying to stand up very, very slowly from that physio ball that's just going to start to gain some strength in those legs. So you can certainly start right from there. It can be as easy as that. All right, so adjustments in a rhythm, breaking the bad habit, doing the exercises to strengthen the spine. When we talk about breaking the bad habits, let's unpack that one just a little bit here so you know what I mean. So the bad habits are going to be in the categories of how you eat, how you move, and how you think. And so when we talk about having a bonfire, if your bonfire is your health, the fuel is what you eat, the air is how you move, and spark is how you think. And you need all 3 of those in order to have that fire. You could have a pile of wood and a nice wind, and if there's no spark, you have no fire. You could have a match to light a spark, but if you suffocate that fire, that wood, it doesn't get any air, it's not going to burn. And you could also, of course, have sparks and air, but if there's no fuel for it to burn, you don't have a fire. So you need to have all 3 of those in order to have true health. So you can't just think, okay, I exercise all the time, I can get away with whatever I want to eat, and who cares about stress? You won't get what you want that way. You have to do all 3. How you eat, how you move, and how you think. So the best practices for eating is going to be anti-inflammatory diet, getting healthy proteins in. It's going to be high in healthy fats and things like fish oil that are going to keep your omega-3 strong, keep that inflammation down. And then how you move. Well, people have tried exercising, but they keep re-injuring themselves. So then they stop exercising. But it's kind of like a cavity. Should you stop eating food if you have a cavity? No. You just want to do the right thing. So less sugar and more brushing is what you want to do. So low back pain doesn't mean stop all exercising or sitting. It does mean doing the right exercises at the right time and sitting the right way for the right time. So you want to keep an eye on your sitting. 30 minutes, every 30 minutes, try to move around a bit. Make sure you have really good posture when you are sitting. Otherwise, that bad habit is going to start to build up. So again, we talked about the specific exercises to do. Also just looking at functional movement. So the idea of training movements, not muscles, and just training for life, having good technique. And, imagine like, this is how I feel when I'm at an airport, and if I'm late, I might have to run to get to that flight, and I'm in good enough shape that I can run and I can do it. And sometimes I feel like I'm passing like those 28-year-old couples, and maybe I should stop and do CPR on them because they're not fit enough to make it to their gate. But it's not because I, suddenly had that burst. It's because I'm just staying in that fit level. And so that it's just living life in a functional way that allows me to do that. And so then when you think about how you think, getting enough rest and downtime, making sure you're sleeping over 5.5 hours up to 7 hours, because that's the key time when healing occurs for repairing cells and renewing. So I'm going to say that again. If you go to sleep, you want to have at least 7 hours of sleep, because it's not until after you've already been sleeping for 5.5 hours, that's when certain things are happening for your sleep. But healing of injuries and low backs and that kind of thing, it only starts after 5.5 hours. And then it continues on into that, up until that 7th hour. So if you're not sleeping more than 5.5 hours, then you're going to be robbing yourself of repair time that you're going to need. So make sure you're aiming for those 7 to 8 hours of good sleep. And then how you think, how you sleep is going to affect how you think. Taking time to do things that you like to do to recharge your batteries. It's interesting that the most common time that people get disc injuries is during divorces for men and when they're financially stressed, and the sacroiliac when people are not feeling supported. So those are the common times that we see those types of low back injuries. Be mindful with your movements and pay attention to the body's signals. And then just breathe into an area and ask that area, what are you trying to tell me? Like, just take some time with your body on how you're thinking about it. All right, so we covered all the main categories there. And so I hope you have found this useful. If you have any other questions, you want to set up a call with me, I'm happy to do that. Just text my team, the 802-985-9850 number. I'm happy to just set up a 10-minute conversation. Chris, I'd be happy to just send up a 10-minute call with you just to see how things are going, get an update. Happy to do that. So if you want, I could have my team reach out to you, whatever works for you. Great. All right. And then, Rich, thank you so much for being on the call. If you have any questions, you can always ask in the office as well. But thank you, everybody that's watching this recording, for taking the time to move through it as well. And so I appreciate that you are want to learn more. And if I can help in any way, I would love to do that. So I'm going to just stop the share here, and I'm going to finish up our recording and wish everybody that's watching it to just have a great evening.